So hello everyone and welcome to today's Tools for Frontline Staff sessions. Today we have Razia Lunat with us, who's part of the Early Help Hub, which is run by London Borough of Hackney. So I'll hand over to Razia and let her explain what this is all about.
Hi, thank you, Rachel. Hi, so my name is Razia and I work in the Early Help Hub. I've got the presentations. Just bear with me. I'm just gonna. Can you see it?
No. Yes.
Yeah. Perfect. Just gonna put on a slideshow. I've just emailed Eric as well, by the way, and he will be joining in 5 minutes. He's just had some difficulties with Google Meet. Right, so I'll just start anyway. So hi everyone. I work for the Early Help Hub in Hackney. So what is the Early Help Hub? Early help refers to support for children and families to help identify and address problems before they arise or escalate. It is not a single service, but a network of non-statutory services and processes delivered by a local authority and partners, including NHS, schools, and the voluntary sector organisations. Early help can range from lower level universal services delivered by a single agency to more specialist and targeted interventions provided by the multi-agency and multidisciplinary team. The nature and intensity of support provided may change depending on the needs of each child and family over time. Cases may be stepped up to statutory services or stepped down. Sorry. Please tell me if I talk too fast as well. So yeah, it can be stepped up to statutory services or stepped down from targeted to universal early help. Early help can be offered to a child or young person and their family at any point up to their 19th birthday and its 25th birthday if they have special educational needs. So when families, so we offer early help targeted support where appropriate and link families into the right services at the time of need. So the principles of early help is that there's no delay in getting the support. There's a central point of access. So there's one referral form to children's services, and it's via MASH service. We offer consistent evidence quality of support. Our work is predicated on consent for support and consent to information sharing. We're multidisciplinary working led by families with the family present. Our interventions are evidence-based. Sorry, I missed the line. We work with parents as experts and know that work with young people should always involve the parents as well. Our interventions are evidence-based and ongoing service development is led by the needs of the children, young people, and the families we work with versus the evidence-based intervention we can offer. Our work is underpinned by commitment to anti-racist practice and informed by an inclusive understanding and appreciation of Hackney's diverse communities, cultures, beliefs, and family structures. So following the review with Early Help Hub was established within the multi-agency safeguarding hub, which is MASH, and it serves as a central point of access to working with children, young people, and families. The Early Help Hub is a dedicated team that screens requests and identifies the most appropriate support for families. The hub can allocate to family support within targeted early help where required, or provide professionals with advice about where to best signpost a family, or a universal response is more appropriate. So the pathway, like I said earlier, is just one request to support form. If you have concerns, you're unsure whether it hits tier 3 level threshold, which is safeguarding concerns, it's still one pathway. So the family are going to get some sort of support, whether you think the concern is low level or at high level. Once a referral is sent in, it is screened by the MASH managers and they will determine whether there's early help support or whether a statutory level support is required. After this point, they will be screened by either a MASH social worker or within the Early Help Hub, which is myself, and we have 3 members in my team. and we screen more or less all the early help referrals. So the time scales are consistent. We have in the Early Help Hub 72 hours to make contact with the family, to have a discussion with the family or the young person directly, and then we will then follow it on to the right service or the most appropriate service to continue with that support. It could either be a universal service or a signposting to a community service within Hackney, or whether targeted support is needed. Just to go back, so there are 3 services on the Early Help offer. One of them is the MAT Family Support Team, and they work with families where the child is 0 to 6 years old. So that's including pregnant women and parents. And then the other service is family support from 6 to 19, again, 25 if they have SEND difficulties. And then the last one is Young Hackney, which is targeted support for young people on a one-to-one from the age of 6 to 19, again, but if there are SEND difficulties and up to 25 years old. We receive referrals from a number of services. It includes the police, the ambulance, schools, GPs, mental health, community, adult, self-referrals from families themselves, housing. So, you know, it can be from anybody. So the new form to be used when requesting support for a child or young people and their family at levels 2, 3 or 4 of the Hackney Child Wellbeing Framework from Hackney Council Children and Education Services replaces the previous forms of the multi-agency information form. Request for support rather than referral, because we are requesting support for the family. Content of the form must be shared with the person or parent concerned, and consent must be obtained. Obviously, there are circumstances when consent cannot be given, where you think that there is a high risk to the child, then, you know, or the consent will place the child at further risk. You do not need to obtain consent, but it's always great to kind of let them know. If there is no risk, if there's no risk, then please do gain consent from the family. So we work in line with the Hackney Child Wellbeing Framework. Early help will be level 2, and that is within the early help services across Young Hackney, family support and MAT. Universal would be signposting to stay and play services, for example, or youth activities. Level 3 and level 4 would be more of the statutory level, child in need or child protection kind of caseload. So again, with the consent, definitely request this before you send a referral in to us. Obviously, again, just want to, you know, if in circumstances where consent cannot be given, if it cannot be reasonably expected that a practitioner obtains consent, or to gain consent would place child at risk, then of course you can, you know, send it through without that. Unsure what to do? We do have a consultation line at MASH. MASH provides a professional consultation line offering advice and guidance to partner agencies. Where partners do not have consent or don't know whether the threshold is being met, unsure whether it's level tier 2 or tier 3, you just want to sound out a referral even, please, you can contact the consultation line. The number's on the below, and I'm sure these slides will go out to you all. Oh, I think that's it. Just want to, I thought there was one more page. So where some of the universal services that we will kind of refer on to could be a host of services like shelter or citizen advice bureau. It could also be within the SEND team, so SENDIAGs for SEND advice. It could be faith-led activities, support groups, charities, Hackney migrant centres. So it really depends on the individual case of the family, and we will have that discussion with them to really understand what's going on for that family and for other family members as well, so that we're making a decision for everybody and that everyone's everyone's concerns are seen to. And if you have any worries after between 9 and 5 and you're worried about a family after this time, there is an emergency duty line again at the bottom of the screen, so you can contact them as well. That's it from me. Is there any questions?
Charles.
Thank you, Roger. That was a great presentation. And I know when I was a frontline officer, I often referred things through to MASH. Then and now, obviously, things have changed since then. I know that in the past, organisations have expressed sorry, let me rephrase that. Some of the voluntary sector partners I've worked with in the past have been worried about how to contact the council around families, because obviously that's quite an emotional thing for families. Does the Early Help Hub have a kind of a strategy about thinking about how to manage that worry for families coming in?
Yeah, definitely. I mean, so we aren't social workers within the Early Help Hub. We're all early help practitioners. So I think families tend to a bit more relaxed when they speak to us because they're not talking to a social worker. So that really does help. And then we also explain our level of service, and if things were to get worse, then how social workers would need to be involved. But there's always transparency and clarity around that. A lot of families are really taken back that we're there just for support rather than criticizing their parenting in any way. So that really does help as well. So far, I do have to do the whole reassurance spiel sometimes that, we're here to support you. We're not here to and that kind of does reassure them, and they are very engaged with the discussion that we have with them. And then that really helps them kind of engage with the ongoing support. So whether it's Young Hackney, whether it's family support, they are much more in tune with what service they're receiving.
Thank you. That's really helpful.
Thanks.
Abby?
Hi, Razia. Thanks for that. I was just thinking about, being that we've got quite a few colleagues on the call and quite a few more who might watch the recording of this, and thinking that this is a great opportunity to find out what are some of the challenges that you still are dealing with in terms of running the services and actually getting them to the people who need it at the time that they need it, or in working with colleagues across the whole system, and what you might hope that other professionals and colleagues know or could say to them at this point that would actually make your lives easier in the Early Help Hub and get families the support they need as quickly as possible. Mm-hmm. That was a wordy question, sorry.
Yeah, it was. I hope I can remember it all. So I think before Early Help Hub came about, it was quite difficult, because what would happen is a lot of families that are vulnerable and need support, they will then be kind of screened by social workers and end up in assessment. It's not hitting the threshold for tier 3 kind of level of safeguarding, which then would mean that assessment is kind of no further action and closed. And these families are in need of support, but they're not hitting that safeguarding, but then they're in this void, if anything, if that kind of makes sense. I think what the Early Help Hub has changed is those families that are not hitting that and do need the support, because without that support, it could escalate. They are then receiving that support quite quickly. With the Early Help Hub, again, we have a longer time to screen families, which means that 72 hours still seems like very short compared to, it does still seem short, but social workers only have up to 12 hours. So they are really just want to know if there's any safeguarding, and they want to get out as quick as possible. Whereas with us, we've got 72 hours. So we can then have more time to explore avenues and pathways that can give that family the right support, rather than us saying, yeah, you need family support, just go there. And they're like, no, we don't want that. We want something to do with housing, or we want some benefits checked. And family support's just going to open it and be like, we're not housing, we can't help, and close. And that can really, not destroy families, but they can really get upset about that, because they want the support and they're not knowing where to access this. Whereas we would then we have links with Shelter or Citizen Advice Bureau or the Link Work team, and then we can speak to housing as well and make those kind of discussions and start up those links so that that family feels a bit more supported. And okay, now I know where I'm heading. Yes, I'm struggling, but it's to do with environmental factors, and maybe that's would impact better on my parenting if those sort of things were kind of lifted. Again, we don't make promises. Obviously, housing have their own crisis and we can't promise them we're going to move them. But what we can do is just make sure that their voice is being heard and that they're linked into the right services so that they understand that, okay, this is the reality of me living here. How can I, change things? How can I be more adapted into whatever it is that is causing concern? And that networking within early help, which is why all our staff, well, there's 4 of us, we do, really strive to have these good connections with different services, especially organizations outside of the early help offer that we have, because we want to make sure that, families are being seen and heard and they're getting the right support. So I hope I've answered that question.
Thank you. I think Ali indicated she wanted to speak.
Thank you, Rachel. This is really interesting. So I worked in early help across 3 different boroughs, and it feels like Hackney's got a new approach, right? As in the form, referral for support, that makes such a difference as opposed to a referral, So I'm really glad to see that. And you spoke about, like, in your team, it's the not social workers. So I worked in a different borough, and I'm not going to mention the borough it was, but I remember going on a home visit, and I was accompanied with a social worker, and totally different energy when you're working with the family as to response. And there was a family that we met, and this lady had adopted a young boy. The adoptive mother was white and the young boy was black, and she was in distress. Anyway, I was able to share something personally, and it opened a really different conversation where I think, even though when people are referred into early help, it's not social services, it's not statutory, but if your colleague next to you is a social worker, it feels like you're still in that room. The other thing I just wanted to ask was, so one of the difficulties I had in that role was the caseload and the amount of time I was able to spend with the family. So basically, from getting the referral to getting them out the door was sometimes 6 weeks. Mm-hmm. And a lot of time people have complex issues. So I'd be interested to know, like, how long you're allocated per family and what are your caseloads like?
Okay, so that is a good question. So within the screening team, we don't hold cases. So we get a batch of referrals that are coming in. I think in a week, we probably screen around 100 referrals, and that's between 4 of us. And what we'll do is, once it's in our tray, we'll obviously read the referral, we understand what the referrer is requesting. We'll then may make contact with that referrer to kind of get more information, and then we'll have a conversation with the family. From that discussion, it will depend on where it's heading, and if I think it's family support, it will be progressed straight to family support, who will then allocate a practitioner who would go and do a home visit. So we don't do home visits at all at screening. It's literally one call, but that one call does really make a big difference to that family, because they are, first of all, not just not knowing what's going to happen, because sometimes referrers will just refer in for support and they're not sure what service they'll even go to. And then if it does go to family support Young Hackney, it will really depend on their individual needs as to how long they'll be working with that family. It could be 3 months, it could be a bit more than that. It will really depend on the family situation. They would, do an assessment to really understand and explore their lived-in experiences, and then devise a support plan. So really, that's what usually happens. Very rarely do families come back and be like, we want more support. once that concern, once they've been progressed to family support, they won't necessarily come back to us, which then shows us that actually whatever intervention that was done was really useful to the family, unless obviously there's another concern with another issue, whatever, then obviously that would be screened again as a new thing. But yeah,
I can't say how important it is for that first contact, and it sounds like your team are doing that really well, because that can be the difference between. So often it's the attitude before used to be more accusationary, okay, your family, we've had a referral, and your family, the school thinks this, and we're setting off on a ground.
Language is so important, and just by changing that referral to request, then it does make so much a difference. It made such a difference to even the way we kind of speak to families and really understand the situation. And I think that's how the phone call goes to, like, yeah, your teacher was really worried about you, what's going on. And this is with young people as well. We strive to talk to everyone in that family, and especially when it goes to young Hackney, we need to get that voice of that child as well. And speaking to somebody on the phone as a young person, as a one-off, it's a big task, because they don't want to talk to us, they're not going to see us, but yet we do really make a difference by doing that. And they are much more like, oh, okay, young Hackney can help with this, okay, yeah, I might give it a try. And that really does reinforce their kind of willingness to work with somebody, and it does make a big difference. So yeah, Early Help Hub has been running for 2 years now, and hopefully it's made permanent, and it makes it has made a difference to the way we screen referrals, not just with families but with professionals as well. It seems like there's better networking. People are linked in quicker as well, because if they're open to CAMS and they're open to family support, we can make that link at the time of the referral coming in. So it really does help in so many ways.
It's really, sorry, I'm going to shut off in a minute, but I'm really passionate about this. It's really good that you're here. One, I didn't know about this. Two, I thought the route was through MASH, which I never thought was helpful. And three, whoever made that decision to change the name on the form, just say, yeah, I'm not patronizing, but I think that's going to have a ripple effect in the years to come.
Yeah, and just going back on that, the assessments are coming down in social care, which is just showing that actually the people the families that need that assessment are getting those assessments, and the families that are receiving early help are receiving the early help. There's no kind of, the data is speaking for itself in the last 2 years. So hopefully it continues.
Thank you, Razia.
Thank you.
I just wanted to chime in around this conversation with something that Ali, you mentioned to me nearly 2 years ago when I came to visit you for the first time. Whereas officers, as a council officer, you're not always aware of the barriers that you're putting up when you're engaging with communities, whether that's the shoes you're wearing, how you're presenting, the name of your form. So I think it's a really good reminder that the more we break those down and make ourselves accessible to the residents we're meant to be serving, the better it is. So, and Ali, you've long been a champion of that, so I thought I'd chime in with that memory.
No, definitely. And I think it's so important. And I think even in those telephone calls, we can really sound out whether there needs to be an interpreter, whether there needs to be any, changes that need to be made to allow, visits to happen on a day where there's no religious festival, that kind of thing. It can begin some support in the most positive way, rather than someone turning up at your door saying, we got a referral. And we hear, and it really does change the dynamic of it all, for sure.
Thank you. Is any other colleagues got any questions or comments? If not, I'll thank you, Razia, for your
You're welcome.
And we'll now move on to our second presentation of the day, which is from Eric Y. Lung Chu, and he's from the North East London Community Pharmacy Self-Care Advice Service. Eric.
Hi everyone. Hello. Just want to make sure you can hear me, and I'm going to try to turn my camera on because it didn't work just now. Yeah. Hi. Can you all see me and hear me? Great. Just bear with me. It's my first time using Google Meet, so
Eric, just to say, you are a little bit, your sound is coming in and out a little bit, so you might want to turn your camera off, because I think we could hear you better then, unfortunately. The camera is just a little icon, the camera icon at the bottom of the screen. You click that, it'll turn your camera off.
That's fine. Just bear.
Okay.
Yeah, I'm trying to share the screen, and then 1 second. Bear with me.
So sorry, Eric. The sharing screen function is the square with the arrow, the up arrow on your on the bottom of your screen. And it's just
Yeah, I'm trying to. It's going very, very slow.
okay.
And then I try to turn off the camera, and then like I click twice to turn it on again.
Okay.
I'm so sorry for that.
Mm.
So Rachel, I'm just wondering, by any chance, do you have the slides with you? Because it's just going very slow on my
Could you put a
end.
link in the chat maybe?
No, it's on my own drive, so just 1 second. There you go. Should be fine. Can you see my screen? Oh, it can't see my screen.
No, we can't, I'm afraid. I mean, it should come up with a thing and say choose what to share, and it says Chrome tab, window, or entire screen. And if you've got the tab, it'll show all the tabs you've got open, and you just click on.
Yeah, I did click that, and then there's like an error has occurred. Okay. Is there any way I can send it right here or no?
Yeah, just if you just want to go through your slides maybe and just explain.
Okay. Yeah.
Eric, you can also email one of us the slides and we can present for you.
Yeah, that would be great. Can someone just...
I've stuck my email in the chat, Eric. If you see that, you can send it to me and I can present.
Great, thank you.
No worries.
There you go. I just sent it through. Let's see if that works. Yeah, I just sent it.
I've got those. Give me just 2 seconds.
Thank you.
There is brain damage and he's in a coma, and they don't know how long he'll be in the coma or what his state will be if he wakes up. So I'm sitting there and setting.
Sorry.
If we go with that, Eric, rather than it transmit it to Google Slides and then if just I can scroll as you want me to.
That's fine. Great. Thank you so much. And I'm so sorry for the IT error. It's my very first time using Google Meet, and unfortunately, our work laptop doesn't support that. So sorry in advance. My name's Eric. I am the lead pharmacist from the ICB team that's leading on the community pharmacy self-care advice service, but also at the Pharmacy First. So I don't know who the audience are here, but I'm just going to give you a bit of background in terms of the Pharmacy First. So Pharmacy First is a national commission service by NHS England, and then it started back in the 31st of January this year. It is the kind of phase 2 of the previous service that's known as the CPSAS, which is a community pharmacy consultation service. And this nationally commissioned service is available for over 95 pharmacies in England have signed up to do that, and it is optional. And within Northeast London, we actually have 364 out of 370 that have signed up to provide the Pharmacy First service. So Pharmacy First service essentially divided into 3 different elements. The first one is minor illness. The second one is clinical pathway for the 7 specific clinical conditions. And then the last one is the urgent medicine supplies. So the minor illness essentially is by referral only, and it can only be referred by the GP to the participating pharmacies. That is to kind of provide advice or and also recommending medications for any minor illnesses. And as Charles showing right here, these are the list of a general conditions where the GP can refer patients to the participating pharmacies for minor illnesses. But just to say, like, this list is just an example, it's not exhaustive. And the next one is the clinical pathways. So clinical pathways essentially is the pharmacies where they will be able to provide the prescriptions only medicines for 7 specific conditions. And in order to access this service, patients can either be referred by their GPs, or they can walk into any of the participating pharmacies right there. There are some restrictions, and also like in terms of what can and what can't they do for different patients, but I'm sure the slides will be shared with you guys afterwards. So please do have a quick look and just to be aware of that. And I think one of the most common one in terms of is sore throats, like if patients having sore throat they encounter with, they no longer actually need to see the GP, they can actually go to the pharmacy directly. And also some of the conditions will also include children to be able to access for these certain conditions as well. So the main focus that I want to talk to you guys about is the community pharmacy self-care advice service. I know that in City in Hackney that there was a previous minor element scheme, and that has now finished. And the community pharmacy self-care advice service is kind of a newer versions of the minor element schemes for the previous one that's running in City in Hackney. So this scheme has actually started back in 22nd of July. One of the main reasons why we want to launch this scheme is mainly because what we've noticed is a lot of patients been referred from their GP to the community pharmacy by Pharmacy First. And what happened is the community pharmacist recommended certain medications for that particular minor illnesses. However, unfortunately, patients were not able to afford these medications that unfortunately have to be bounced back to the GP to get them prescribed on a prescriptions. So therefore, we have launched this scheme, first of all, to be able to reduce health inequality by able to provide free over-the-counter medicines for certain cohort of patients that is for a limited conditions. At the same time, we're not only focusing on the free of charge over-the-counter medications, but also the advice and general support in terms of health and well-being, which I'll be coming to that later on. At the same time, these services will be able to reduce the workload on the GP and the A&E attendants, because they can, because patients with any minor illness conditions can simply be referred to the community pharmacy, where the community pharmacist will assess patients' eligibility criteria and they provide this service accordingly. Next slide, please. So this is just to give you a little bit of background check in terms of like how the health inequality is happening and deprivation in Northeast London. So unfortunately, in Northeast London, we are one of the most deprived ICB within the London area, and we've got around, and also 24% of the now populations are actually living in the area that's ranked with the most deprived 20% in England. And also at the same time, we do have quite a significant high percentage of asylum seekers, refugees, but also homeless residents going around in Northeast London. And so that's another reason why we want to launch this scheme, is to kind of increase access to these advice supports, but also free of charge over-the-counter medications via these pharmacies. So next slide, please. Okay, so in terms of how to access the service, so as I said earlier, we have got 310 pharmacies that's currently providing this service. And then the list of the pharmacies that have signed up to provide this service, I will be shared with the local authorities and they will be circulated widely. And we've got 370 pharmacies in total. Now we've got 310 sign up. And actually the remaining ones are Boots and Boots Pharmacy. And that's roughly 40 of them, which they will be coming up soon. So we're looking at around 350 pharmacies to be able to provide the self-care service over the next 2 months. So in order to access this service, all patients must be referred to the participating pharmacies via their registered GP in North East London. It's very simple. Basically, what they need to do is just to contact their surgery and then say like they have this minor illnesses conditions. And then what the GP routinely do right now is to first ask patients whether have they visited a pharmacy first. If not, then they will be able to do the referral. And then this service will have certain eligibility criteria, which I'm going to cover in detail afterwards, but it also covered 24 specific conditions, but not all minor illnesses conditions. In terms of the workload-wise for GPs, essentially what they need to do is just to send a referral to the community pharmacies, and patients just have to contact them. And some I know that some practices in City and Hackney are actually having those self-triage module, similar to eConsult, where actually patients just click online and then once it's been done, the referral will automatically be sent by their GP to the pharmacies. So all the patients must be referred to by the GP in order to access this scheme. The only exceptional cohort will be those patients who are homeless, asylum seekers, and refugees, which they are allowed to walk into any participating pharmacies. Next slide, please. So this is just a very quick pathway just to indicate you in terms of how the patients flow and whether are they eligible for this service or not. I know that's quite small print right there, but again, the slides will be shared after this meeting. Next slide, please. So as I mentioned earlier, the conditions that's being covered by under this scheme are limited. So we've got 24 specific conditions. As you can see right here, there are some highlighted in reds. Those are the ones that were not previously covered by the City and Hackney Minor Element Scheme, which is now being covered by this self-care advice scheme. Next slide, please. So this is to focus on the eligibility criteria. So as I mentioned earlier, the walk-in is only acceptable for patients who are homeless, asylum seekers, or refugees. For patients that who were referred by the GP and then will be able to access the scheme, i.e. getting the free advice, but also the free over-the-counter medicines, mainly are those patients who are under the age of 18, where they have at least one parent who are on any kind of financial benefit. This also includes any young care leavers, but also young people that's under the care of the local authorities. In terms of adult-wise, all adult patients who are on any kind of financial benefit will be eligible to access this scheme. This also includes patients who are on HC2 certificate, any low income support, etc. So if you come across any family that currently are on any income benefit where they could not afford any over-the-counter medications, this is one of the services where you can signpost that patients to go to. But again, I just want to highlight that is a by referral only. So please make sure that they need to approach their GP first. And once they visit their pharmacy, please make sure they need to know and highlight the fact that they might be eligible to the self-care advice schemes. So the service does not provide full range of any available over-the-counter medicines. We do have a set of formularies that's provided to the participating pharmacies to provide certain products for certain conditions. However, there are some minor illnesses conditions where patients can actually receive more than one type of over-the-counter medicines. An example that we use right here is diarrhea. So patients that are having diarrhea that have been referred by the GP where they're eligible for this service. they can get the loperamide, but also they will be able to get rehydration sachets. That is depending on the clinical appropriateness, which will be assessed by the community pharmacist. And I just want to highlight that this scheme is only eligible and only for patients that are presenting with any short-term minor illnesses conditions. For patients that require repeat medicines, an example will be long-term allergies where they require regular antihistamines. This is not appropriate via the scheme, and this should be prescribed and managed by the patient's GP. Next slide, please. So how this address the health and inequalities? First of all, as I mentioned earlier, is to provide a free of charge over-the-counter medication, but also at the same time, part of the service that the community pharmacists are expected to do is to provide any advice that's around health and well-being. And this includes any blood pressure, sexual health, any contraception, smoking cessation, etc. And where appropriate, patients can be referred to any other services that's appropriately. For example, if patients have a headache that's presented at a community pharmacy, which one of the suspected reasons could be high blood pressure, then patients will be subsequently referred to the community pharmacy blood pressure check service, which will take the opportunity to have the patient blood pressure checked to make sure that it's still within the normal limit, etc. So that's how we kind of also try to reduce health inequality by making every single contact count. But also at the same time, the community pharmacies are quite spread out in North East London, and it is often that the staff working in the community pharmacies will be able to have representations from their own community, particularly speak their own languages. So that's another thing that which we help in terms of kind of tackling the hard to reach patient groups, just to make sure that they're more aware of that, but also to have the reduced communications barriers, etc. So next slide, please. So we have developed a posters that is for circulations that will be mainly used for organizations where homeless, refugees, and asylum cohort seekers are at the moment. The reason why we are not publicizing this on like public display is because that most of the patients will require referrals from their GPs into the community pharmacy. And as a result, we don't want to have a surge of demand at the practice level. So that's why we're not publicizing that. But we are only using that to kind of target those patients who are eligible for the walk-in cohort. So there, we also have made the translated version for the posters, and there are 11 in total, which will be circulated to all the local authorities in North East London soon, where they can use to displays at such as homeless hostels or any kind of events that's targeted to refugees and asylum seekers. So the last slide right here, there are more informations which you can refer to. I know most of them can be internal link. However, if you have any access issue, please do email the generic queries, which I'm happy to respond. But again, if you have any questions around this self-care advice service, please do email the generic inbox, or you can email me directly if you want to. Any questions? And thank you for sharing this slide.
Thank you.
Is there any questions?
Is there any questions? Charles.
Sorry, Eric. So I was mostly focusing on trying to make sure I was on the right slide. So I was making sure I got. I tried as well. Is this information going to be directly sent to the hostels where lots of asylum seekers are residing? I'm conscious this is quite important information. It'd be great to get it to the right people quickly.
Yes, correct. So basically, I've got contact for all the resettlement leads from the local authorities that are kind of like looking after the homeless and asylum seekers and refugees. So yes, correct. These posters and also the information will be shared with the relevant leads at each of the local authorities in North East London. That's correct.
Fab, that's great to hear. That's probably Eden in our service, but sounds like it's getting to the right place.
Yeah, but I think I also want to take this opportunity to ensure that every patient or every colleagues that you encounter with, to be aware of this service. It's just because that it is a locally commissioned service. We don't want to do a hard launch as such, but we want to kind of like raise awareness, ensure that patients are aware of that. And also we are asking our community pharmacy providers to proactively provide this service as well. But at the same time, patient has their own right to know that the availability of these services. So that's why the whole purpose of it is to raise awareness, to ensure that all of you guys are aware of that. And we are also trying hard to promote this service just to target the homeless, refugee and asylum seekers as well.
Thank you.
Thank you. Has anybody else got any questions they would like to raise?
See, there's a question in the chat. Is this service available
I'm
for
not
those
able
no
to
recourse?
sort of flick between the chat because I've opened a box on my computer which I can't close. Do you want to read it out, Charles?
Is this service open to those with no recourse to public funds?
Sorry, say that again.
Is this service open for those who've got no recourse to public funds?
When you say public funds, what do you mean by that?
So some people might have the status whereby they've been designated NRPF, which means that they're not eligible for certain benefits, but they are also quite a vulnerable cohort because they aren't in receipt of a particular benefit.
So no, because what happened is when the providers, when they check the eligibility criteria, some of them do require evidence to show that they're on income support benefit. So I think there is a kind of tools, like it's called RTEC, which allows the pharmacy provider to check whether it's patient on certain kind of benefits or not. But for patients to be eligible on this scheme, it has to be on authorized benefit from the government. I hope that answers your questions.
Thank you.
Thank you. Has anybody else got any questions they wanted to raise? If not, I'll say thank you to Eric and I'll turn off the recording.